has recorded nearly 3,000 cases of dengue this year alone. However, a drastic increase in fogging across the country has resulted in a decline in the number of dengue-related illnesses over the last week. Minister of Health Dr. Frank Anthony told the Department of Public Information that Guyana is not the only country affected. He said more than 5 million cases were recorded in the Americas.
For this year, we were able to do approximately 11,240 tests so far. And of those tests, we have identified 2,852 persons who've tested positive for dengue. And of those persons who have tested positive, we have seen 265 of them needing some form of hospitalization. We have had, so far for the year, we have had 2 deaths resulting from dengue.
Dr. Anthony noted that the regions most affected are 1, 2, 4, 6, 9, and 10, and he noted that these regions are being closely monitored. Minister Anthony outlined an action plan that includes dispatching control teams and equipment to fog breeding sites. And the results?
This week, we have started to see a decline in cases. So that's a positive side. And that's because of the fogging activities that we have that are ongoing.
The minister is urging residents to remove stagnant water from their surroundings in order to prevent the disease-infested mosquitoes from breeding. He is also asking people to use repellents and take additional precautions to avoid being bitten. The Ministry of Health is distributing a larvicide called Abate to various communities, and in the coming days, treated bed nets will be distributed as well. Minister Anthony is urging those experiencing dengue symptoms to get tested. He said thousands of rapid testing kits have been distributed countrywide.
I think people should be cautious, and especially with children, if they have fever, don't take for granted that they have flu. Just bring the children to one of the facilities to get tested, and so that you can be properly advised by a professional. So don't assume anything.
He explained that during the first phase of dengue, an infected person will experience fever lasting 1 to 3 days. In more severe cases, dengue can cause plasma to leak, causing dehydration or bleeding, which could ultimately cause a person to go into shock. These symptoms of severe dengue include vomiting blood, internal bleeding, skin rashes, and abdominal pain. Dr. Anthony emphasized the importance of seeking medical intervention when the symptoms are severe, and he advises against using aspirin for mild symptoms such as fever, but instead suggested using paracetamol. The health minister said a vaccine developed in Japan has been effective against certain types of dengue. Although the vaccine is costly, the government of Guyana is making efforts to procure an adequate supply.
I think it's costing maybe about $98 to $100 per vial. So this is something that we have looked into, but even while it's very costly, it's not readily available. So we have been looking into possibilities of trying to procure, but it's still a challenge.